Welcome everyone. Today discuss about healthcare diagnosis issues, and beside that, we will discuss about diagnosis for health and wellness centers, and we will discuss about ILTS. We have our healthcare worker, Mr. Peace. Hopefully, other students will join. This year, in the month of February, under this is the project of World Health Organization, Ayushman Bharat, the government of India, and 150,000 health and wellness centers would be created by transforming existing sub-center and primary health center to deliver comprehensive primary health care. The credibility of the health and wellness center rests on the availability of essential medicine and diagnostic for a wide range of service provided by the HWC. In the line with the paradigm shift envisaged, the HWC will provide a broader range of services, and this necessarily expanding the list of essential medicine and diagnostic service currently available. Objective. I'm just giving you a good model, because when we see some good model, this good model actually help us to understand different things. With regards to the diagnosis services, the HWC, the primary objective is to minimize the movement of the patient and improve the timeliness of reporting. This can be achieved by following the hub and spoke model by creating the hub at CHC, depending on the distance and population served. Status will need to define context-specific protocol for peripheral collections of the SEMS from HWC. Focus. Infections and associated disaster reduced, but is still high in many states. So in the COVID-19 situations, what's going on? This is important. If we can take some good model, then it will be helpful for us. So in that situations, we need to be very much careful. Uh, we need to be very much careful about that. So infection and association disease is reducing, but is still high in many states. The burden caused by this condition generally continues to be much higher in empowering action group and northeast state group than in the other state, but there were notable variation between the state within this group as well. Rising burden of the non-communication disease in all states, increased but variable burden of injuries among states, unacceptably high risk of children and material malnutrition. This burden is highest in the major EAG state in Assam. Unsafe water and sanitation improving but not enough yet, contributing 5% of the total disease burden, mainly through diarrhea disease and other infection. Bharat Abhiyan in India has the potential to improve. Household air pollution improving, outdoor air pollution worsening. The burden due to household air pollution is highest in the EAG state. Work to improve since 1990s has also been slowest. On the other hand, the burden due to outdoor air pollution is highest in the mixed northern states, including Haryana, Uttar Pradesh, and Punjab, and Rajasthan, and Bihar, and West Bengal. Rising risk for cardiovascular disease and diabetics. The combination these risks can highlight in Punjab, Tamil Nadu, Kerala, Andhra Pradesh, and Maharashtra in 2016, but importantly, the contribution of this risk has been increasing in every state of the country since 1990s. This is some of the important diagnostic centers. So they go for hemoglobin, human chronics, urine, ketone, blood sugar, malaria, HIV, dengue, water testings, and many other things. Uh, Beside that, they have PHC, hub tab lab for PHC or HCH. This is some of the modern equipment they utilize. Although the delivery of universal comprehensive primary health care through HWC building on existing system, it will need change, management and system design at various levels. To realize its full potential, uh, follows are challenges foreseen and implementation of the diagnosis program in HWC. Rationally, service provider MLHPS MPWS, PHC staff will need to be trained to undertake counseling for rational use of diagnosis and appropriate consumptions based on treatment plan. State or district would require to plan for periodic prescriptions audit, robust quality check on quality of medicine, use of IT system for ensuring rational use of medicine and diagnosis. Equipment would be added at the HWC level in accordance with the expanded range of service. Certain diagnosis equipment will be required by MLHP as per requirement from PHC. Supply chain management. In order to provide the assured set of services, developing basis diagnosis facility, HWC is a priority. The DVDMS system need to be extended to be PHC level in those states where it operate and be enabled on a priority basis where it is yet to be implemented. Robust procurement system and use of e-Oshhadi system would be vital for such of mechanism. Issue of poor outcome related to supply side deficiency need to be addressed for this. So these are the various kind of challenges we have. We can add the various kind of interesting things in the healthcare management system. So healthcare is very, very important. And most important thing is that at present in the healthcare system, we focused on supply chain management. We focused on how we can manage good SOP, how we can manage good environment, how we can cooperate with different kind of challenging things, especially in the COVID-19 situations. We have lot of challenges, we have lot of activities, we have a lot of initiative, but fact is that how we maintain our SOP in a professional way, this is most important. And beside that, you have to understand that World Health Organizations, they also have many challenges, they also have many interesting aspects. So what we have to do, we have to be very much careful about the healthcare existing system. So we have different speakers. So I request Diana, if you can help us to understand more about African healthcare system. This will be a brainstorming session for us, and we can understand how our colleagues and our friends actually working in Rwanda.
Thank you so much, Mr. President. Our Africa healthcare system, in our time, it has been changed to digital, but most of African countries, since many years ago, it has been based on curricula and natural materials or products which couldn't meet with the new era of science matters. Now it has changed, which is still maybe even major issues from that natural product to the new uh, medicament which needed to be taken from laboratory or from science structures. So, however, other developed countries, they no longer focus on those natural, only during the research. But in Africa, we still have behavior or mindset of some citizens or some
Mhm.
even researchers who need to focus on the natural medicament, which is still stuck to the new era of digital science matters. Thank you.
Thank you. Mr. James, you are my friend. So, what is the present conditions of African healthcare conditions, Rwanda health conditions? I'll have to learn more that how actually they get vaccine and how actually your healthcare friends they are working right now. Mr. James.
Uh, Thank you so much. Sorry, I didn't got you clearly.
Okay, like I want to know more about African healthcare system, Rwanda healthcare system.
Healthcare system,
Yes.
how they work, or which kind of technology we are using.
Yes.
This is what you want to know.
Yes.
Yeah, actually, for Africa, the healthcare system is still growing because most of the countries are not using the technology-based health systems. So we are still growing in this case because there is no much of sophisticated technology in the healthcare system for the African countries, but still, particularly coming to Rwanda as my country, we have so far improved, and we have established some good partnership with some exotic hospitals and exotic health systems of other countries, especially in the West, whereby they can borrow this technology and expertise. So we still have only the skills gap, because when you compare the number of patients per doctor is still very high. So we still need a good number of medical practitioners, medical doctors and nurses, because the number of patients per doctor is still very high. And this means that there is a skills gap in the health system for the African countries. Number two, there is a raw usage of technology. So this is how I can express the portrait of the health systems in Rwanda and Africa at large.
Excellent. And one thing, like example, how, Mr. Peace, how actually you communicate with your patient, how you communicate with your people. Mr. Peace.
Yes,
Yes.
thank you. In Rwanda, it is a country where more than 90% of Rwandans, they speak one language. They can understand Kinyarwanda, so we communicate with them through our mother language, Kinyarwanda. So they understand, no problem regarding the use of languages.
Okay. So, Uriwangi. Anyway, so second thing, like example, if Mr. Peace, I give you a task, let's say you find out a article about Rwanda healthcare system in English, and can you share with these articles, and can you read the articles? Let's say our audience love to know more about healthcare system in Africa.
This time,
Yeah.
so on Wikipedia, it says healthcare in Rwanda. The healthcare in Rwanda was historically of the poor quality, but in the recent decades has been greater improvement. Rwanda operates a university healthcare system and is considered to have one of the highest quality health system in Africa.
Okay.
The history in the pre-genocide era before 94, Rwandan's healthcare was supposedly supported by the Bamako initiative, which was sponsored by UNICEF and WHO, and adopted by African ministers of health in 1987. The progress was started toward decentralizing the health management system first to the province level and then to the district level. Unfortunately, this was disrupted by the genocide in 1994, which crippled the healthcare system alongside the economy. In the past, the post-genocide period, Rwanda has had an uphill climb in the recovery of its health system as well as its economy. However, it has since built one of the best healthcare system in the region. 2008, the government spent 9.7% of national expenditure of healthcare, compared with 3.2% in 1996. Healthcare system become mandatory for all individuals in 2008. In 2010, over 90% of the population was covered. In 2012, only about 4% were uninsured. The president made healthcare one of the priorities for the Vision 2020 development program, boosting spending on healthcare to 6.5% of country gross domestic product in 2013, compared with 1.9 in 1996. The government has devolved the financing and management of healthcare to local communities through a system of health insurance providers called Mutuelle de Santé, where piloted in 1999 were made available national worldwide of mid-2000. With the Association of International Development Partners, the mutual are owned and managed at the level of Rwanda district. There are a separate national health insurance scheme for public servants and soldiers. Premiums under the scheme were initially $2 per annum. Since 2011, the rate was varied on a sibling score according to the health, with the poorest citizens to free health insurance, and the healthiest paying premiums of $80 per adult. In 2013, more than 90% of population were covered by the scheme. The government has also set up training institutes, including Kigali Health Institute, which was established in 1997 and is now part of the University of Rwanda. In 2007, President Paul Kagame also launched a program known as the President's Malaria Initiative, aimed to help get the most necessary materials for prevention of malaria to the most rural area of Rwanda, such as mosquito net and medication. The Rwanda follow universal health care model, which provide health insurance through the Mutuelle de Santé. The system is a community-based health insurance scheme in which residents of the particular area pay premiums into a local health fund and draw from it when in need of medical care. Premiums are paid according to the slide scale, which poorest member of the society use the services for free, while the healthiest pay the highest premium and are charged copay for treatment. The quality of healthcare system, we operate in 499 health centers and 680 health posts, which are mainly involved in the outpatient programs such as immunization, family planning services, a number of dispensaries and 42 district hospitals. The country's villages are served by a network of 1,000 community healers. There are 4 national referral hospitals, which are Kigali University Teaching Hospital, one is in Butare, another is in Kigali, and the Rwanda Military Hospital. Most advanced of them is King Faisal Hospital, which is operated in front profile model by the government, but participating in the national health insurance system, and therefore accept patients referred to it by hospitals and clinics. It is the most advanced hospital in which equipped with CT scans, MRI machines, to dialysis machine, and a wide range of surgical capacities. Yes, I can talk by here.
Thank you, Mr. Bliss. Humaira, what is your advice? How they can improve their reading, especially if they want to get a very good score in IELTS?
Pardon, repeat the question.
Yes,
Mm.
I'm
Hello?
asking question to Humaira.
Okay.
Mr.
Thank you for giving me the opportunity. First, I would like to thank all of you for joining the session. You people are really hardworking. I know that, and you have dedication. So I believe that if you can read newspapers and IELTS, I mean newspapers. If you hearing the news, so that you can easily catch their pronunciation, their way of talking,
Like
and you
you
have
are
to
talking
improve your
about,
reading
they have
habit.
to they have to listen news, right? From BBC and
The
CNN.
news have BBC and CNN, and also they have to increase their reading habits, because last week I told them that vocabulary is very important issues in IELTS. If you want to get a good marks, say for example, I can say that you can increase your knowledge. It's some common vocabulary. Everyone understand that increase means you have to upgrade. But if you can use enhance, intensify, these are high vocabulary words, and it can create some values. I mean, you can get some extra points of using the high frequency words. In SAT 1, have you ever heard the term SAT? SAT is another exam upgrade. It's like IELTS TOEFL PT. So they have high frequency words. Those are very important. That in reading part, you have to know the meaning, what they are explaining. If your vocabulary is not, I mean, that much rich, then you cannot catch the points. I think Sharif already explained everything very clearly. So that's it.
Thank you. Devotee,
You're most welcome.
can you share like what you learned today? Devotee, can you share what you learned today? Devotee, can you unmute and discuss what you learned today?
Okay, thank you.
Okay.
I'm sorry I'm coming late. I didn't catch the topic of today.
No, what you
Excuse me.
learned from Humaira? I think I saw that you attend when Humaira discussed about reading. Christine, what you learned today? I cannot hear you clearly. I cannot understand. Ramla, Ramla, what you learned today? Ramla. Okay, Mr. James, what is your advice? How we can improve, especially in this reading related exam? Mr. James.
Yes, thank you very much. I think the way to go is making the practice. You know, however much someone can listen very much, she or he cannot do it more better when she or he cannot practice the same that is trying to be taught. So I just want to encourage these colleagues to make sure you become flexible, you become open, and speak from whatever you can, such that you can be able to learn. You cannot learn when you're still like when you still have some level of inferiority. There is no like someone who is more better than the whole world. You know,
Exactly.
Everyone can learn on a daily basis. You see, so I just want to encourage you guys to be open to try to speak however much you can speak this English that is somehow broken. It's okay, but next day you will not be making the same mistakes. You know, mistakes are the raw materials for to succeed. As you make mistakes, you're next to your goal. So please, just be free, be flexible, speak whatever you feel like. This session should be as participative as it could, but if we keep cool, if we keep calm, we cannot easily learn. So I just want to see everyone participating, everyone raising up her or his hand, asking questions, active sessions. Thank you.
Thank you, Mr. James. Diani, what is your summary for today? Diani? Okay, Humaira, what is your summary? How we can improve?
Yes, I completely agree with Mr. James as he explained that practice makes someone perfect. It's already proven that practice can make someone perfect. If my mindset is like that, yes, I can do it, then I definitely will achieve the score. Yesterday, I heard one of my sister. She attended 6 times, and after that, she got her desired score. So, how dedicated she was to achieve that score. So, I think more practice can make you perfect. So, I think I have to give chance to Diana.
Diani,
Thank you, everyone. Take
what is
care.
your summary?
Thank you, Mr. President. Thank you, Maria, and thanks others. Yeah, I can't go aside of other who said before me. I still have trust, and I hope the success for the participants. If they keep hard working, if they keep open. I know a few days ago they started interacting, even great interaction. The way even they respond questions, the way they lead. And thank you so much for those who did participate on time, particularly Peace and the others. They vote also others participated today. Madam Lamla, they vote. Christine, please keep it up. Let's interaction be at forefront and be ready because soon before exams, get prepared. And I need to promise, Mr. President, we are going to enforce, effectively so that a day to day, We can have evening hours to remind them, reading, also interact so that they can be open. They can trust themselves. Yes, they can win, but the problem is that they need also to trust themselves, to act also hardworking as you used to advise them. Thank you so much. Yeah. Thanks
Thank
for
you.
your
Thank you.
important time and for encouragement.
Thank you. I in the inbox I give you a report of United Nations about Africa. Okay, Africa healthcare system. Okay, healthcare system time for rethink. Pain from crash in commodity price. Africa hope for new UNTF. Okay, this is very good report about Africa renewals, about African healthcare system. So I share with you. I request all of our students, those who attended the exam, please read this article and make a summary. And tomorrow, I want a presentation about African healthcare system, about your country, about your region, about your motherlands. There is a very good report from United Nations. Please read it, make a summary, and prepare for a presentation. Thank you, Mr. James, Diani, Peace, Humaira, Ramla, Devotee, and Christine for joining today's session. Please, Mr.
Thank you
James.
very much.
Yes, you can share this report to your students
Thank you,
in
Mr.
inbox.
President.
Thank you. Bye bye. Bye bye. Take care.
Bye.